When it comes to heart health, food myths are as persistent as they are misleading. Somewhere between old-school nutrition handbooks, flashy magazine covers, and well-meaning relatives quoting advice from the 1980s, a tangled mess of half-truths has formed and stuck. These myths often oversimplify the science, vilify entire food groups, and make eating for your heart feel more like navigating a minefield than enjoying a meal. But let's clear the air and your plate by busting a few of the most stubborn heart health food myths that continue to hang around like an overcooked steak at a vegan barbecue. Let's start with one of the oldest. All fats are bad. This myth has done more damage to our understanding of nutrition than just about any other. In the fat-phobic frenzy of the 1980s and 90s, low-fat everything flooded grocery shelves, often with sugar, starch, and artificial ingredients added to keep things palatable. The result? People ate fewer healthy fats and more ultra-processed carbs, a perfect recipe for rising rates of obesity, diabetes, and yes, heart disease. The truth is, not all fats are created equal. Unsaturated fats, found in olive oil, avocados, nuts, seeds, and fatty fish, are heart protective. They help reduce LDL cholesterol, lower inflammation, and even raise HDL, good cholesterol. Trans fats, on the other hand, truly are villains and have been largely banned for their clear link to heart disease. Saturated fats? The jury's still debating, but moderation is key. Ditching all fat is outdated advice. Your heart needs the right kinds. Next up, eggs clog your arteries. Ah, the humble egg. Once celebrated as nature's perfect protein, then demonized as a cholesterol bomb, now, well, finally back on its throne. For years, eggs were shunned because of their high cholesterol content. One large egg contains about 186 milligrams of cholesterol, and it was assumed this would directly raise blood cholesterol and spike heart disease risk. But research has since shown that, for most people, dietary cholesterol has only a modest effect on blood cholesterol, and that saturated fat has a far greater impact. Eggs also contain heart-friendly nutrients like choline, selenium, and antioxidants lutein and zeaxanthin. Unless you have a specific condition like familial hypercholesterolemia, an egg a day isn't just safe, it might actually be beneficial. Then there's the heavy hitter. Red meat is always dangerous. Red meat's reputation is one of the most controversial in nutrition. It's true that high consumption of processed red meats like bacon, sausage, and hot dogs has been strongly linked to increased risk of heart disease, likely due to their high sodium, saturated fat, and preservative content. But unprocessed red meat, like beef, lamb, or pork in its natural form, is a more nuanced story. Lean cuts, eaten in moderation and balanced with plenty of plant-based foods, don't automatically translate to heart disease. Context matters. A grass-fed steak alongside roasted vegetables and olive oil is a different meal entirely than a cheeseburger with fries and a soda. The demonization of all red meat oversimplifies the science and ignores how quality, preparation, and dietary context shape health outcomes. Another myth hanging around is the idea that carbs are bad for your heart. Carbohydrates have become the new fat in terms of fear, but again, it depends on the type. Highly refined carbs and added sugars are problematic and have been strongly associated with obesity, high triglycerides, and insulin resistance, all of which can increase cardiovascular risk. But whole carbs like oats, quinoa, brown rice, legumes, fruits, and vegetables are rich in fiber, vitamins, and antioxidants that actually protect the heart. It's not carbs that are the enemy, it's the wrong carbs in the wrong amounts, especially when paired with low-quality fats and sodium. And let's not forget the myth that if it's plant-based, it must be heart-healthy. While a diet rich in whole plant foods is absolutely beneficial, not everything labeled plant-based is automatically good for your heart. You can be vegan and still live on potato chips, sugary cereal, and meatless nuggets that are ultra-processed and lacking fiber or real nutrition. The key is whole, minimally processed plants, not just swapping out meat for highly engineered soy protein snacks. Plant-based isn't a free pass. It still requires good choices. Finally, the idea that eating healthy means giving up flavor is both sad and wildly untrue. Some of the most heart-friendly cuisines, like the Mediterranean diet, are bursting with herbs, spices, olive oil, garlic, fresh vegetables, grilled fish, and nuts. Eating for heart health doesn't mean you're sentenced to a life of dry toast and unsalted oatmeal. It means embracing balance, richness from the right fats, natural sweetness from fruits, and deep flavor from real ingredients. So yes, the world of heart nutrition is complex, but it's also full of freedom when the myths are swept aside. Fat isn't your enemy, eggs aren't traitors, and red meat doesn't need to be banned like contraband. The key is quality, variety, moderation, and staying grounded in what science actually says, not what old brochures or diet fads want you to believe. Your heart doesn't need rigid rules. It needs thoughtful nourishment and a little common sense on the plate.